Hello, my name is Jackie Shapin. I am a licensed marriage and family therapist in Los Angeles, and I am here to support anyone here that's struggling with OCD and has questions about OCD. I'm doing this through NoCD, and I am going to help as much as I can today. So I will just go ahead and get started. I hope everyone had a good OCD awareness week last week. The whole month is OCD awareness though. So I hope that I can answer as many questions as I can for the next hour. And if I can't, I will provide you with some resources. So let's get started. Hi, Cherry Milk. Cherry Milk says, advice for dating with OCD, not necessarily relationship OCD, just dating in general. So I don't exactly know what advice you're looking for. What I can say though is it's really important, whether you have OCD or not, to live your life towards your values. One way that, hopefully you can live a fulfilling life that you enjoy and that you love and that you feel good about is by living it towards your values. And so if you value connection, you value dating, you value being with people, then I would suggest for sure moving forward with that and not letting mental health or your mental wellness get in the way of you doing things that are towards your values. So not exactly sure what advice you're looking for, but I would say that I wouldn't stop or avoid doing something because of fear. If you have a more specific question, please let me know. One thing I do want to put out there that I should is this is not therapy. This is educational. And even in therapy, it's not my job to give advice, but I can help and encourage you the best that I can. Does this start at 8 p.m. Eastern time zone? It is 5 o'clock Pacific Standard. So yeah, I believe it is 8 Eastern time. Thanks, Mercy. That's what I'm guessing. Laney, is it normal for a 16-year-old to not want to do ERP? She hates her not sure what that means, but ERP is so hard. Oh, she hates her OCD, but ERP is so hard. How common is needing medication to get to a point to even do ERP? Laney, thank you for asking this. So it is very normal. There's a lot of normals, but it is very common for someone to not want to do ERP. ERP is really difficult. ERP stands for exposure response prevention, and it is the gold standard of treatment for OCD and research backed. And it isn't easy. It takes, ERP takes leaning in towards your fear, leaning in towards discomfort. It's about accepting uncertainty and doing things that make us purposely feel anxious so that we can learn that we can handle it and build a different relationship with our anxiety. So it is very normal to not want to do it. And it's normal to lack that motivation, even though OCD, even though she also hates her OCD. So it is very common. I am not a psychiatrist. I can't I don't want to say too much about medication because it's out of my scope. However, what I will say is what I say to my clients, that a lot of times medication, the metaphor that people will use for medication with OCD is I forget what other people say actually. I say it's like holding your hand. There's something about medication for a lot of people with OCD when they try it, that it helps them do the exposures. It helps with motivation. There's like this thing that sometimes clicks for people where they weren't able to do it before and then they're on a medication and they're able to do it. I wish I could remember the other metaphor besides holding your hand that people say. But it can be very helpful. Now, obviously, everyone is different. And there's some people, a common medication that is utilized to treat OCD is SSRIs. However, if SSRIs for whatever reason don't work, then there's also SNRIs and there's other medications. So it's really important to talk to a psychiatrist about it. So it is common to pair medication and ERP together. And I'm sorry if this is a loved one of yours. It is difficult, but part of seeing a therapist who specializes in ERP is also part of like our training is to help work on roadblocks to doing the treatment. They sometimes call it TIBs, treatment interfering behaviors. So that is also part of therapy, is talking about that motivation and talking about what are some things that might be getting in the way of being able to do these things that are going to help the 16-year-old. Tamia T. Hi, I work from home and can't focus due to severe OCD. Can't function in my own house even. I am so sorry. I'm so glad that you found OCD and that you found this group. I hope that you really dive in and utilize it as much as you can if you have that ability. If your OCD is severe, it doesn't even have to be severe to get help. But if you're noticing it is severe, there's also the option of higher level of care. So there's individual outpatient therapy, which a lot of people do. They go to therapy once a week. There's also a higher level of care. So there's going to a residential treatment where you are there every day getting help for your OCD. There's also programs that are partial programs where you're maybe not living there. There's programs that are multiple times a week. So I really strongly encourage you to get the support that you need, and you can talk to someone at an OCD or another expert in the OCD field that does ERP to find out what level of care might be best for you, especially if you're having a hard time functioning. I mean, that's definitely a big indicator that this is something that's severe, because it's getting in the way of your everyday life. And that is one of the criteria for OCD, is that it's causing significant impairment in one or more areas of your life, which can include work. Justin Olson. Hello, what should I do if I forget something and say the what if I don't remember this will happen? Or what about the if you don't do this, this will happen? Then I get anxiety and it's a vicious cycle. So you bring up a very common occurrence, and that is this vicious cycle. I'm gonna go over the cycle really quickly in case those of you don't know it. So the OCD cycle can also be similar to other cycles that we have in life where we are utilizing something to cope. So the OCD cycle, and I don't know which way to do it facing you, but basically it starts with an obsession. An obsession is anything that increases your anxiety. It can be a thought, it can be an idea, it can be an image that pops into your head and it increases your anxiety and distress. That is an obsession. So that's the first part of the cycle, is that we get this obsession. Then following that, there's an increase in anxiety. So the obsession causes anxiety. After that, we are humans and we want to feel better. And so it is natural for us to want to try to do something to get rid of that anxiety. And so that is what normally is a compulsion. So a compulsion is something that we do as a way to try to decrease or get rid of distress or anxiety. The reason why it's called a compulsion is because it is something you're doing to reduce anxiety that is repetitive and provides temporary relief. So that's the last part of the cycle, is temporary relief. If the compulsion works forever, then it wouldn't be called compulsion, and you wouldn't be in the cycle, because if it worked forever, it wouldn't come back around again. And so that's why it's a vicious cycle, because these compulsions provide temporary relief. They might give you relief for a moment, a couple hours, even a day. But the fact that it comes back around again and you're doing the same cycle with the anxiety going up and then doing something to make your anxiety better, and then it gives you a little relief fast, that is temporary. And so that is the cycle. And what the treatment recommendation is we can't get rid of the obsessions. I'm so sorry. I wish we could. Can't get rid of the thoughts that pop in your head. But you have the choice and the power to change the way you respond. And so the way to break the cycle is not to somehow get rid of the thoughts. And it really isn't to get rid of the anxiety. It's to have the obsession, have that anxiety, and to not have a compulsion, and realize that as time passes, you will survive. You will be able to get through that sense of urgency and that discomfort, and you will be able to ride that wave. So basically when you put, if I have the thought of what if, or if I don't, then this will happen, those sound like obsessions. And then because of that, you get anxiety, just like you said, then I get anxiety. So what I want you to do is, can you feel that anxiety and not have to do something compulsive about it? Can you notice the anxiety? Can you describe it in your body? Can you tell yourself, all right, I'm feeling a lot of anxiety right now? Can you utilize self-compassion and say, wow, this is really hard. I'm having a really hard time. And I also don't need to do something about it. All right, Madison says, is embracing uncertainty more important than embracing the content with exposure so much? Dr. Reed Wilson says that uncertainty is the root of OCD disorder, so embrace that, right? So Dr. Reed Wilson is an amazing resource for any of you guys looking for like more people to look up and resources. I don't remember everything that Dr. Reed Wilson said, so I'm just going to go with what you said and kind of respond. Embracing uncertainty, according to what has worked for treatment, is an amazing intention or goal to have. Because if you can embrace uncertainty, then that means you can have an obsession. And instead of trying to figure it out or solve it or do something about it, embracing uncertainty is having it and having it and responding by saying or thinking, man, I don't know what's going to happen. And I'm going to write out these feelings and I'm going to just wait and move forward in my life and just see what happens, as opposed to stopping yourself and having to figure something out. Richard Parker, hello, says, I was watching my phone the other day and it brought up something about blinking. And I've always sometimes focused on my blinking, like if I'm blinking on time. And so I looked up what that was and saw OCD. Well, now my mind is stuck on this one uncomfortable feeling in my groin. It's like a feeling of not being able to sit still. So I have to shake my leg to get rid of it, or so I don't feel it. But, sorry, I'm trying to find, but ever since I've been thinking about it, I can't get rid of it, and it's driving me crazy. It can make the intrusive thoughts worse. Like, what if this drives me to do something? Is this OCD or something? I think I'm going to stop there. Something else. Okay. So let me go back. So let me first address the blinking. So it is definitely related to OCD. I've seen this before where we get hyper focused. It could be like it could either be a somatic OCD theme or it could be a just right theme. But it sounds like what you're saying is then you start overthinking about your blinking, and then you start blinking in a way, and then you feel like you have to like blink correctly or blink until it feels right. And so whatever that worry is, what I would recommend you doing, what would be exposure and response prevention, is to flood yourself with the thing that would make you constantly think about blinking, and then blink wrong, whatever that means to you. So I had someone who had this with swallowing. And so for exposure, they had to swallow a certain way, and it would get in the way of them feeling like they were going to be able to breathe and continue. And it was getting in the way of work. And so one exposure that I had them do was I had them write on sticky notes, blink. Can you blink? Are you blinking right? Drawing eyes. And I had them put them all over their apartment so that they couldn't get away or avoid this thought about blinking. So they were like purposely bringing on this anxiety about blinking. For them, sorry, it was breathing. And so every time they saw it, they had to basically face that fear, face that distress of like not knowing if they're going to be able to swallow right. And it would make them hyper focused on their swallowing. But they did it on purpose because they also learned through psychoeducation that as uncomfortable this is, as concerned as I am about not breathing right, I know I've talked about my worst case. I've talked about my fear. And so I'm going to just have a problem breathing. I'm going to lean into it, and I'm going to breathe incorrectly, or I'm going to try to not breathe. So whatever it was that was the opposite of what their OCD was telling them is what they would do. So whatever your blinking is whatever your OCD is telling you that your blinking should be doing, try doing it wrong. Sometimes it's hard to like people will say, just stop. And it's not as easy to just stop, and that's not helpful information. So instead of just thinking, well, don't do it, one way of relapse prevention or like preventing the compulsion is to do the compulsion wrong. let me know if that answered your question. All right. Brianna says, I've done ERP for a month and I'm in tears after ERP. Is this normal? I feel like I'm failing. Brianna, I just want to say that I'm really proud of you. It's really hard work. The fact that you're in tears kind of just shows how much you're in pain and how much you're really trying to fight back to this OCD. So you are not failing. And in fact, I don't think anyone that is working towards bettering themselves or is trying to do ERP is failing. It just really shows that you're facing distress. So I'm proud of you because it sounds like when you're doing ERP, you're really feeling it. If you're crying and you're not doing your compulsion and you're feeling that anxiety, it sounds like you are doing the hard work. And I'm so proud of you and I want to commend you. What I will say is if it's discouraging you and if all of your homework is bringing you to tears, are there other exposures that you're also doing that bring up a little less distress that you could also do? So that there's some that maybe give you tears and that there's some that aren't. Are you doing imaginal exposures? Are you doing things that are a little bit less on the distress scale? It's not a problem that you're crying at all, so that's not why I'm saying this, but I think when you do exposures that sometimes feel a little less distressing but are still difficult, it can help build that muscle up and give you that motivation to keep going and then do the harder ones. But according to what I'm reading right here, you are not failing and you are really doing that hard work, and so keep it up. I also want to encourage you to talk to your therapist about it or talk to whoever's teaching you about ERP to see what they say, because all I'm getting is these couple of sentences, and so I don't really know the whole story. So I also would check with your provider in case I'm giving you wrong information for your specific question. Jalissa, what are your thoughts on medication? So again, I'm not going to say too much about this because it's out of my scope. I'm not someone who prescribes medication, did not go to med school. This is a question for a psychiatrist. However, I have learned about medications for OCD, and I also have clients who have used medications and have not used medication. And I have seen it do amazing things for so many people. Just because you go on medication doesn't mean you have to go on it forever. And just because you go on medication doesn't mean there's anything wrong with you. Medication can be really, really helpful in treating your OCD along with ERP. So my thoughts are I support what my clients want to do. If they are having a really hard time doing ERP and it just doesn't seem to be clicking, like that motivation and like doing the actual homework. Because here's the thing is doing ERP homework once a week is not enough. Going to therapy once a week for OCD is not enough. You have to do homework ideally daily or multiple times a week. So that you're really practicing that muscle and learning that you can handle the distress that comes from these irrational obsessions. If you cannot get yourself to do that, sometimes that's what medication really, really helps with. It helps cross over this bridge to doing the exposure and response prevention. Caleb says, oh, cute little cat picture. Caleb says, how do I dispel the negative core belief that my brain is broken? I try to practice self-compassion, but when this thought pops up, I feel hopeless. So I think that there are a lot of different ways that someone could respond to this. I'm not going to be able to just, wave a magic wand and get rid of that negative core belief like I wish that I really could for you. What I will say is you're not alone. A lot of people that struggle with OCD question and feel like their brain is broken. I'm here to tell you your brain is not broken. Your brain does have extra firing in your fight, flight, freeze, fear response of your brain. And that's what makes someone with OCD have the difference between someone with OCD and someone that doesn't, is that you do have that extra firing. It's your brain protecting you. It's your brain having a rational firing from things that aren't really in danger, but it's working. Your brain's trying really, really hard. What sucks is that it's going off when it doesn't need to. And so your brain is not broken. What's really cool is you can look up through brain imaging is that through doing ERP and doing the right treatment for OCD, they do notice that the brain does change a little bit and that firing does calm down a little bit. I think it's great that you practice self-compassion. And when this thought pops up and you feel hopeless, you can also utilize self-compassion to really be there for yourself when you feel hopeless. This self-compassion exercise that I've been using a lot more lately, that they'll call like a self-compassion touch or physical touch. I can't remember what else they call it, but basically it's when you do some sort of touch to comfort yourself when you're struggling. And what's nice about it is that you don't have to use words. And so I want you to try to add that self-compassion physical touch when you're feeling hopeless, because it can really help calm your nervous system. I typically will put my hand here. It feels good to me. It's natural. Some people will use both. I have one client who noticed that putting her hand on her shoulder feels good. Some people will touch their face. So giving yourself self-compassion touch can be really nice. So try to add that on. You also don't have to try to fight this hopelessness. If you're feeling hopeless, meet yourself where you're at and acknowledge how you feel. Just because you feel hopeless doesn't mean that you are. And so I don't necessarily want you to think that feeling hopeless is the end. I think it's just important to acknowledge you feel hopeless and then decide what's gonna help me, or like what's gonna be the best thing for me to do after I acknowledge feeling hopeless. And a lot of times it's doing what you value. It's doing things to get support from other people. Feeling hopeless is really, really difficult. And so I want you to, when you're feeling hopeless, I want you to think, what would my future self feel if I did X, Y, and Z? You know, like if I'm feeling hopeless and I normally would, I don't know, maybe stay in all day and isolate, would my future self feel better? Maybe not. Maybe going out, calling a friend, would my future self maybe feel better if I did that? Maybe not right now, but my future self would like that, then maybe trying to do that. I also want to point out, sorry, I'm saying a lot about this, Caleb, but I think the fact that you know you have this negative core belief that your brain is broken is incredible insight and awareness. And I think even just knowing it is helpful, because then when you have that thought come up or that belief come up, you can notice like, oh, there's that belief. There's that belief. I'm going to just give myself compassion because it's so hard that I feel like my brain is broken. And can I act as if it's not? Is there something that I'm doing or the decisions I'm making based on this belief? And even though I believe this, can I do what I would do if I didn't believe this about myself? Oh, there's so many questions. I gotta go faster, huh? All right, Lauren, advice for hair pulling. So hair pulling is often called a BFRB, which stands for Body Focused Repetitive Behavior. And the treatment for BFRBs, or things like hair pulling, skin picking, nail biting, is called, there's a couple kinds, but one is habit reversal training, and one is using the COMB, C-O-M-B model. So they're a little bit different treatment, because OCD is what we call ego dystonic, which means that the obsessions are not in line with our values. We don't like them. They cause distress. Same with the compulsions. Whereas with hair pulling, it's a little bit different. A lot of times hair pulling is ego syntonic, meaning there's something that feels good about it. And so that's why the treatment for hair pulling is different from the treatment of OCD, even though they are kind of put together, because I don't know if I have the right answer for why that is, but OCD and BFRBs are often put together, even though the treatment is different. Okay. When it comes to false memories, is that exclusively for not being sure what happened, or can full vivid memories be constructed that never happened? So what I will say about this is the more we act out on compulsions, the more we can start to reinforce and come up with ideas that actually haven't happened. So with false memories, what can happen a lot is, and the way that I'm thinking about false memories is, you are triggered by this uncertainty of a memory or not knowing what really happened. And so then the compulsion is to try to figure it out or ruminate or go over every single thing that maybe happened at an event to try to figure it out. And this is a compulsion. And what happens is the more you give into your compulsions, the more your brain can actually start to come up with things that really never happen. So compulsions can actually create memories that did not happen because it starts imagining things the more you think about it and the more you like go in circles. So it can be about not being sure about something. It can also happen about memories that it can show up in all the ways that you're sharing. Merci, hi. It says advice for real event OCD. So similar, I guess, advice or what I want to educate about all themes, because the treatment for OCD, no matter what theme it is the same. And it is facing this core fear that you have underneath. So what would be helpful to ask yourself is whatever it is that your obsession is about, this particularly like, did this event really happen, or this real event happen and I can't stop thinking about it, is accepting the uncertainty, accepting that you're going to feel distress and that whatever you've been trying to do to help that distress probably hasn't been working because you're here. And so not answering these questions, not trying to figure something out, not trying to get reassurance, all of those things are compulsions. So my advice for everybody here is whatever your worry or thought or belief or image that's causing you distress, can you notice it? Can you name it or label it? And then can you ask yourself, what would I be doing right now if I wasn't having this obsession? And can I do that instead of whatever else my OCD is trying to tell me to do? Brandon, how do you treat OCD when dissociation is also involved? Do you need to treat dissociation first and then do ERP? The client also meets criteria for OSDD. I'm not sure what OSDD is, so maybe you can let me know. I wish I could answer this question. It was easy, but it really depends on the client. It's important that whatever is most significantly interfering with the person's life is what you want to treat first, and safety as well. So you want to make sure that whatever is the most harmful in their life, whether it's because it's impacting them medically or it's impacting their safety, you want to look at those things first. So whatever they're coming in with that's the most severe is the best thing to start with. So it really depends on the dissociation, how much it's happening, how severe the dissociation is. If someone is dissociating and they're doing ERP, what's hard a lot is if you're dissociating while doing ERP and you're not actually present, then you may not actually be able to feel the discomfort and learn that you can handle it. And so it's important to really discuss sometimes, are there lower scary or there are less scary exposures we can do to where you won't dissociate, and start with those? Because if someone might be dissociating when they're doing ERP because it is too distressing for them and they need to do things that are less stressful or less scary so that they don't dissociate. Oh, there's so many questions. I wish I could get to all of them. All right, I'm just gonna keep going in order. So Nelly, sorry if I'm saying the name wrong. Cool picture. Any advice for ERP with mind compulsions? I find it easier to do ERP for physical compulsions, but with mind compulsions, I don't know how to implement ERP. So I think another way of what you're saying so that other people can understand is there's 5 different compulsions. One of them is like behavioral or physical, things that you have to do that you feel like you have to do that's gonna make you feel better. I get what you're saying. It's easier. Like you figured out how to either not do it or do it wrong or get in the way of doing it or not avoid it, or change up whatever the, why can't I think of it? The ritual is. So mind compulsions are mental compulsions. I want you to think of them as mental behaviors because you're still doing something. And so how can you create distance between the obsession and automatically doing these mental compulsions? Again, just like behavioral compulsions, noticing it, increasing your awareness to these mental compulsions is going to be helpful. And there are a lot of different names for mental compulsions. And so I would encourage you to ask your provider or look up a talk on mental compulsions. I know Allegra Castens did one. Kimberly Quinlan, who has an amazing podcast called Your Anxiety Toolkit, she has a 6-episode series on her podcast all about mental compulsions. It's called Your Anxiety Toolkit. And she has 6 episodes where there's different therapists talking about their different ways that they help their clients with mental compulsions. So again, one of them is noticing it and not engaging in it. So if you're trying to figure something out in your head, noticing it and thinking to yourself, you know what, I could keep going in this cycle, but I'm not going to. I'm going to ground and notice how I feel in my body. I'm going to notice that I really want to figure this out. And I'm going to notice that I feel so uncomfortable. And I'm also going to realize that I know this is going to come back if I try to figure this out. And so instead, I'm just going to sit with the uncertainty that X, Y, and Z might happen, or that I may never understand X, Y, and Z fully. Lily asked a similar question to somebody else. How do you do ERP when dissociating? Shutting down is the response. So same thing. I want you to talk to your provider because everyone's different. But you may be dissociating because whatever exposure you're doing is too distressing. It can also be, it can be helpful to make sure that you're really grounded and present purposely before you do ERP. So if you're someone who dissociates a lot and you know, like, okay, it's time for me to do my homework right now for exposure, to ground yourself. And grounding is anything that brings you to the current present moment. One that I say a million times a day, I think, is notice your feet on the floor. Or if you aren't able to notice your feet on the floor for whatever reason, noticing your body taking up physical space wherever you are. Another way of grounding is naming things around you, using your senses. So smelling, listening to sounds, noticing, naming what you see in the room, all things that are grounding you. Now, you're not grounding to distract. You're not grounding as a way of coping with your obsessions. You're grounding so that you are less likely to dissociate, because when you dissociate, you're completely disconnected. Not that that's going to work every time or for everyone, but that is just one tool that you can use to make sure that you are not, that you're at least starting off with the intention of not dissociating when you try ERP. Okay, I think I'm talking really fast. Okay, you guys are on fire today. This is amazing. I was here, I think it was last Monday, and not as much firing. So I'm trying to get to as many as I can. The other thing too is there's a few of these topics that I've recently posted about on my Instagram. All last week was OCD Awareness Week, and so I posted a few carousels every week that may help with some of these questions. So if you do want to check that out, please feel free to. My Instagram is my name, just like it says on the screen, Jackie Shapin Therapy. So if you want to follow me on Instagram, I also share like other people's resources on there so that everyone can get hopefully the right help. You can follow me on there. So on Instagram, it's at Jackie Shapin Therapy. So if I didn't get to your question, you can definitely look me up and follow and utilize that. You can also continue to utilize OCD. I often have books where I share resources that I really like. So let me take a break and do that really quick. So I don't have all of them with me. The only one I have with me right now is this book, Relationship OCD. It's a really, really good book. It also shares basics to OCD in the beginning. And you don't have to have ROCD for this book to be helpful. You could also just acknowledge or notice if you have anxiety relationships. Here's a picture of that, that OCD cycle that I was talking about earlier. So there's the obsessive thought, It gives you anxiety. We do something about it, and it's only temporary, and that's why there's that cycle. There's a resource for you. The other one I talked about was Kimberly Quinlan's podcast, Your Anxiety Toolkit. She also has her website, CBT School, where you can purchase her ERP School, which is an online program where you can learn how to treat your ERP. It's really helpful if you don't have the resources in your area to have a therapist. Okay, Mr. LMFT. I don't know if I'm saying that right. What advice do you have for doctors or other providers who have OCD and obsess about unintentionally causing harm to a patient? What I will say is keep doing your job. OCD is fear-based. OCD is the doubting disorder. To stop your job or to not do it anymore because of your OCD would be letting that OCD win, and it would be a huge compulsion of avoidance. If you are a doctor or a provider who has OCD, do ERP. Be with that client, be with that patient. Notice that you're having these thoughts about harming them and help them anyway and work with them anyway. OCD can be a bully. OCD can be this thing that is just trying to really put these fears in your face. And it's ego dystonic, meaning it isn't really in line with who we are. And so again, OCD is irrational. And so what I would advise you to do is to be that doctor, be that provider, be with your patient, despite having these thoughts. They're going to be there. They're not going to go away. But if you can look at them and be like, all right, I hear you. You're telling me that I'm so worried about the harming this patient, which I care about my patients. That's probably why I have this thought. OCD attacks what we value the most. And so I hear you, and I'm not going to stop doing what I want to do for this client because this is my job, and I'm not going to let OCD get in the way. There are a ton of advocates, especially connected with OCD, who are doctors and are providers and have OCD, who are brave and amazing and share their story. And so if you want, you can look some of those people up to kind of hear firsthand how they did it. But there are many providers who have OCD and are doing ERP and are able to be there for their clients. Sabrina, I'm in my 50s and terrified to do ERP. It's scary. Sabrina, I feel you. I'm proud of you for being here. I'm proud of you for sharing that you're terrified, because I think it's important that you acknowledge your feelings. I also think that you never know what you're capable of until you try it. Some people are terrified to do it, and not to discount or say that all of a sudden it's not scary, but there are some people who the anticipation of facing their fears is so scary, and then they do it and they're like surprised by how much they can do it. So if you have not started, and the other thing too is if it's really scary and you know you're terrified, please get a therapist who is an expert, who does exposure response prevention. You want to make sure that that's what they specialize in, because you want to make sure, especially if you're super terrified to do it, that you're going to the right person, because unfortunately there are people out there who don't have the proper training or are trying to sell you a different type of treatment that may not be as effective. So I want you to be terrified and start therapy. And let me know when I'm back on here, Sabrina, how that's going. All right, Anna Lee, any resource for a family member living with someone who has OCD? My husband has OCD. As much as I love him and want to support him, I feel debilitated as well as time goes by. I'm so glad you're here. There are a lot of family member living, there are a lot of resources for you. I apologize if some of them slipped through my mind, but I'm just going to name some organizations that I want you to look up. I've noticed I'm speaking fast. I'm going to slow down a little bit. The first is IOCDF.org, the International OCD Foundation, IOCDF.org. They have a ton of resources on there. There are groups for family members, so I want you to look up IOCDF.org. I don't know where you're located, so this may not be helpful, but OCD SoCal, so Southern California OCD SoCal is another organization that's smaller than IOCDF. that has programs where family can be involved. IOCDF has a kids camp where it's for the kids and the families that has helpful groups. You could reach out to Rogers Behavioral Health and see about their OCD groups. I can't remember if it's Jonathan Hirschfield or Jonathan Grayson or Jonathan Abramowitz. There's 3 Jonathans in, there's probably more, but there's 3 Jonathans that have books that are amazing. And one of them did write a book about having like OCD and family, or something about family and OCD. So there are books out there. So check out those resources. I know there are groups. I think it can be really important if your husband has OCD and he's in treatment, that sometimes you're involved with his treatment, and that might look like you going to session and learning how you can support him, or learning how you can support him, which might mean not enabling. And so definitely get involved in his treatment if you can. And I feel you. OCD does not just impact the individual person, it impacts their life and impacts other people's life. So I'm glad you're asking this question, because I don't want you to think that just because you don't have OCD that you shouldn't or can't get some type of help. So I'm really glad you're here, because there are resources for family. Let's see. Dragon fruit. Can OCD thoughts not feel ego dystonic? I have 2 different types of OCD, POCD and TOCD. POCD felt ego dystonic, and at first TOCD felt ego dystonic. Over time, TOCD stopped feeling that way. I don't know what you mean by TOCD, but what I will say is POCD, or wait, sorry. Yeah, I'm not sure what you mean by POCD. So I think you're naming themes. So I think when you say pedophilia OCD, I think you're saying pedophilia OCD. I'm not sure what you mean by TOCD. OCD is ego dystonic, and it can mean, this means that the thoughts are distressing, that you don't want them to be there, that they're not in line with who you really are as a person, and they cause distress. If someone thinks they have OCD, but they like their thoughts, or they feel in line with who they are, that's ego syntonic, and that is not OCD. So OCD is always ego dystonic. And sorry, I'm not sure what you meant by TOCD. How do you get over harm OCD with urges? It feels so real. Oh, Taylor, it's hard, and it's possible. So you may not get over urges. You may always have the fear and then the distress, that physical response that comes up, that sense of urgency. I want you to accept that you may not get over it, but what you're going to do is you're going to learn that you can have it and survive. You can have it and be curious and notice, man, I wonder how long this urge is going to last this time. Let me watch that clock, or let me move forward with my life, and while I'm noticing these feelings, and I'm just going to kind of start documenting how long they last, and be curious about it, like an experiment, versus feeling like, oh my gosh, something's wrong with me, I can't get rid of them. So it's not about getting over them, it's about changing your relationship with them. Let's see. Dr. Aurelius, sorry if I'm saying that wrong. Is it better to have a therapist physically with you during ERP than have teletherapy? So it really depends on the person. Telehealth therapy has proven to be so effective and helpful. I used to not do it, and then COVID happened and we were kind of forced into it, and it has been really helpful. Sometimes it's actually better, because if you're in your own home, or you can be out in places where you have the fears come up, then it's great to utilize teletherapy to do exposures while you're in therapy. Whereas when you're in the office, you can't always do that. Now, sometimes you can do exposures out in the world with your therapist as well. So it really depends on what you want. It depends on what your therapist recommends. But I don't want anyone thinking that because they may not be able to see someone in person, that it's not possible, because it really is. So there are benefits to both, to being able to do both. I struggle with identifying what my compulsions are. I think they're mental. Do you have any advice on figuring that out? So one thing I will say is figuring it out can be a compulsion. So what I want you to ask yourself is, what happens, or what do I do after I have my obsession? Now remember, an obsession is the thought or idea or belief or image that causes distress. And the compulsion is the thing that you do to try to reduce your stress. So when you have a trigger and when you have an obsession, what happens? What are you doing? And if you notice it's not physical, it's in your mind, what are you doing? And describe that to yourself. That is, you may not know the title of it, but that is the compulsion, is whatever you're doing in your mind after you get this scary or intrusive or question or command. What are you doing? What happens next? And that is the compulsion. Okay. Again, different mental compulsions. There's figuring it out, which is the same as ruminating. It's like going over something over and over again and trying to figure an answer out. It could be counting in your mind. It could be praying in your mind. It could be reviewing a past event for details in your mind. It could be giving yourself reassurance in your mind. Those are all different examples of mental compulsions. All right, time is passing us by. Brandon, all I see at the end is LOL, I'm being called out in real time, y'all, but I'm not really sure why. So I'm going to go and try to find this. I'm looking, Brandon. I'm not seeing it though. I'm not seeing it what came before that. Brandon said, if T did mean transgender, you might really be transgender. I think you're responding to what is TOCD, and I haven't heard of that before. It doesn't, themes could be anything though, so this might be what you're calling it, but I'm guessing you're obsessing about, because there's sexual and orientation OCD as well. So I'm wondering if you obsess about whether or not you're transgender. I think that's what you're saying. Is that something that you question yourself about? And for all of these things, can you not figure something out? Can you continue with your life, going through your day, and not finding answers, and being in the moment and being present, noticing these thoughts, noticing these fears, noticing the response, and not trying to find an answer or solve? All right, I'm going to go back up. Let's see. Sorry, I'm trying to get to everybody. Let's see. Oh, someone said, you got this. You all got this. Someone wrote to Brianna, Madison, thank you. ERP can bring up a lot. Emotional responses with OCD will vary from sadness to anger to fear coming up. Emotions can be obsessed about. It can be helpful to ask your therapist first. Thanks, Madison, for sharing that. Megan also says, I'm scared to start ERP. So I'm glad you're all here because you're not alone. It is scary. And you know what? Doing ERP, starting it even though you're scared, is doing ERP. Huh? So your first step, your first homework assignment is to go and try it. I want you to try it with a therapist if you can, because not only can it be scary to do it alone, but I also want to make sure you're doing it correctly. So I don't want you to try to teach this to yourself unless you don't have the resources. And then if you don't have the resources, then I want you to check out ERP school, because the price of ERP school is going to be way less than long-term therapy if you can't afford it. So all of you that are scared to do it, I want you to support each other and realize I'm really scared, and doing this is an exposure. And can I just notice the sensations and make that phone call, or do this work? I am so here for you, and I know you can do it. I'm able to distract myself when I'm exhibiting compulsive behaviors, but I have a hard time distracting myself when I have intrusive thoughts. Any suggestions for distraction activities? So I'm actually not for distraction as a way to deal with compulsions. Distraction can be helpful with other things like depression, but I'm not going to promote distraction. There are some people that are a little bit more open to it, but instead of distracting, it's important to acknowledge and notice what's going on in your mind and with your body, to notice it, and then you can turn towards doing something else. So there's a difference between moving your attention to something else or engaging with your life and engaging with your values versus just distraction. So I'm not going to tell you suggestions for distraction. What I am going to do is, I think it's good you have the insight to notice that you have a hard time with thoughts. Well, that is, oh, you're saying it's easier with behaviors to distract from mental compulsions, I think is what you're saying. And it can be really hard, but I'm not going to give you distraction activities because you can do this. All right, oops, we are around that time, so I am not going to be able to finish getting to everybody here. So like I said, I believe this is every Monday. I don't know who it's going to be next week, but I'm sure it's going to be someone great. If you want to follow me and see when I'm going to be on here next, you can totally feel free to do that. Like I said, my Instagram is my name. I think it's right here, at Jackie Shapin Therapy. Let me see. Let me answer one more. I'm going to scroll to the bottom. Let's see. Let's see. Lena Troya says, 10-year-old daughter struggles with feeling of clothes, tons of ERP. What is the best way to manage that feeling without just overcoming pieces of clothes? I'm not sure I completely understand what you wrote, but I do want to say I'm so glad you're here. This just shows that you're supporting and you're learning for your daughter. I'm not sure exactly everything that's going on, but ERP can be done in different parts. So I think breaking down exposures to smaller steps can be helpful. Again, I'm just making this up because I don't know exactly what's going on, but like, let's say your daughter, just anytime she has anything on her body, like she can't handle it, that you maybe start with things that are a less distressing material than another one. And then can you start with having it on for 1 minute and then slowly working your way up to having it on for other minutes, different clothing. So maybe not having a whole outfit on because that might be too much, but starting with one piece. So can you simplify some of the struggle into smaller steps? And that can go for everybody that has maybe long rituals. Can you slowly take out part of your ritual or change part of your ritual? All right. All right, you guys, I wish I could stay longer and answer all these wonderful questions. I'm so happy to see so many people on here because you being here just shows that you have found NoCD, which means you have searched for help. And so whether it's NoCD or it's another organization that helps you, I'm really proud of you for being here and making the time to prioritize yourself and your needs. So I'm again, like, I just want to cheerlead to all of you for being here and taking this time. So I have to go, but I will be back. I'm not sure when, but I will be. And so thank you all for being here. I hope that was helpful. Please continue believing in yourselves and do not give up. Do not give up on finding the right help. Do not give up on yourself. Okay. All right. I will see you guys soon.